How do I recognize a TBI? Many TBIs are obvious. They involve a lot of head trauma, loss of consciousness, and memory loss. However, a majority of TBIs are mild and can too easily be ignored or overlooked. It is important to look out for the following common conditions to make sure proper medical care is delivered. The problems experienced after TBI will depend on where the brain was damaged. Certain parts of your brain are specialized for certain functions, and they all work together to help you function normally. Working together is made possible by important connections between brain areas. Think of them as connecting highways or extensive telephone systems that help these areas communicate. Different locations of damage to these specialized areas and their communication lines will lead to different problems. There are some common physical conditions such as headache, dizziness and balance problems, nausea or vomiting, fatigue and problems with sleeping. Someone may also have sensory issues such as sensitivity to light, noise, or smell. More severe TBIs might involve muscle weakness or paralysis, problems producing speech sounds called dysarthria, or apraxia of speech, or feeding and swallowing problems called dysphagia. Common emotional or behavioral conditions include mood swings, depression, anxiety, and irritability. Another condition after TBI is kind of in the name. A traumatic brain injury often is, traumatic. It may involve a brush with death or a violent situation, and this can lead to post-traumatic stress disorder, which can happen in both military personnel and in civilians. There are also common cognitive conditions that impact thinking, remembering, and communicating, like attention, memory, and problem solving. These cognitive problems can also make communicating with others very hard. For example, attending to the conversation, remembering what someone said, interpreting humor or emotion. When these problems happen, it is called cognitive communication disorder. People may also have problems with language called aphasia, like this man who has a hard time finding the right words to say. A TBI survivor may experience one of these problems, or they may experience several of these problems. Common conditions will improve the most in the period of time immediately after the TBI. Some problems may still persist and become chronic disabilities. Importantly, this is called the chronic recovery phase, which means that even though problems have persisted, and even though recovery may be slower, recovery of functions can still happen for many, many years after the TBI.